Hello and welcome to class this morning. We are going to start off by talking about cements today, and then we're going to get into talking about adhesives. So thank you to Miss Harvey for filling in for me. There is a slide deck in Google Classroom on both of these dental adhesives and dental cements. And the dental cement section is where we're going to start first today. And it's a really long PowerPoint presentation and kind of boring. So I condensed it all into this sheet of paper. So we're going to look at each cement and watch a video on how the cement is mixed. And we'll talk a little bit about some of the uses. We've talked about this a little bit before because we've already mixed some of these in the lab already, but we're also going to go through some of these as we go through the PEs as well. So just a reminder, next time that you come to lab, let me pull up your PEs really quick. You are going to be mixing a zinc oxide eugenol. That was the one where we rolled it into a little ball. So also when we come to lab and mix it, we're going to do that same thing where we roll it into a little ball. So we'll look at that momentarily. And then also we're going to mix another glass ionomer, just like we did last time as well. Or we mix it, it's going to string 1 inch up off the mixing pad, and we'll watch you and sign you off for your PE. So come with those ready to verbalize, and we'll come around, and as you mix, we'll verbalize those with you. Also in lab, it's a 2-hour lab session, so that's when we'll take the time to finish up any of our projects. And if there's any time, spare time, you can always bring things, but I'll also let you place a gingival barrier that you would need to do for whitening. So that's also something, if you are ahead of the game, you could place that too. But there will be also a last clinic session that last Monday. If you would need to make up some of your lab requirements, that is an available time for you, but I'm hoping to get everybody through this 2-hour lab to get all the requirements done and completed. So with that, let's dive into this piece of paper. And now's a great time to pause this and pass it out if we haven't already done that. Also, I'll put it in Google Classroom so that you will have the option to have these links clickable for you as well so that you can review this. So our very first one that we're going to talk about is our zinc oxide eugenol. We're going to go through polycarboxylate cement, zinc phosphate cement, glass ionomer cement, and then composite resin cements. And we are talking about these cements as luting agents, where we're going to be cementing a crown essentially. But as a reminder, cements have a few different purposes, I guess you could say. And what that means is that they could be used for a base, which is for that thermal set. They could be used for a liner, which is that tiny little dot right next to the pulp chamber that helps stimulate tertiary dentin growth and protects the pulp chamber, which we'll place both of those next semester. But these ones in particular today, we're going to talk about them as a luting agent, which is the more runny, okay? That you can use multiple of these for different purposes is really important to remember. So first, let's jump into zinc oxide eugenol, or sometimes we call it a ZOE cement. It really depends on the clinician and the product that they're using. So what we do here is we're going to mix a eugenol liquid with a zinc oxide powder. And usually that will come out white in appearance. You mix this one already, so you kind of know what it looks like. But this one in particular is going to be too weak and too soluble. Soluble means that like it'll dissolve quickly over time as it's in the mouth and mixing with saliva, to be a permanent cement. So this is really great for something temporary, 1 to 2 weeks, and then we would want something more permanent. It also has a sedative effect. We've talked a little bit about this in the past, that eugenol is really great for protecting pulp chambers, soothing that irritated pulp chamber. So it has that sedative effect. Good for temporaries over vital teeth. Vital teeth, it means that they're alive, that the pulp chamber is live and functioning and healthy. Non-vital is something where the patient has a nerve that's dead. Or it's also great for a restoration that's close to the pulp. So this is over here in the far left box, a temporary cement, and you can mix it on a mixing pad or what's known as a glass slab. So sometimes because there's a a little exothermic reaction of heat, it will set quicker. So sometimes if you have a cooled glass slab pulled out from the fridge, that will increase your setting time essentially, or your working time. So be able to mix it and work with it a little longer before it sets. That's when you might want to use a glass slab. But for this one, you can use both. There is a longer working time, as you noticed when we rolled it into the little ball. It takes a little bit longer to set. So let's look at how this one is mixed, and then we'll move to the next one.
Zinc oxide powder on a cool glass slab and make increments. Now take appropriate quantity of Walden pure eugenol. Incorporate large quantity of zinc oxide powder into eugenol and mix in circular motion. This creamy smooth consistency is luting consistency. And if we add more powder into the creamy consistency, we will achieve putty consistency or base consistency. The putty or base consistency is achieved when the cement rolls over the glass slab without sticking.
So back to our table, we are going to next look at what's called polycarboxylate cement. This is where we're going to mix a polycarboxylic acid liquid and a zinc oxide powder. Now notice above in the zinc oxide eugenol, what powder was used there? Also a zinc oxide powder. So you'll notice below the zinc phosphate cement uses a zinc oxide powder as well. So sometimes we've taken these two um, acids and these powders and we mix them together and we can make different types of cements. So let's talk about the polycarboxylic acid and what it's used for. It's a temporary cement. You can mix it just traditionally on a mixing pad, but it uses that polycarboxylic acid and a zinc oxide, which is not often used anymore. So it's a little, we phased this one out kind of in dentistry, but still for boards, you have to know about it. It's very biocompatible, which means there's not a lot of allergic reactions that come along with this, right? But it's not very strong. So that's why they decided it's probably great for 1 to 2 weeks, but then we have to transfer it out for something more permanent. Its solubility resistance is rated only as moderate as well, so it will wear away by saliva and spit a little bit easier. If you've worked in dentistry a long time, you might know it by the name brand Duralon. So that is polycarboxylic acid. Let's see how it is mixed here in this video.
Gather your material and supplies. Prepare powder by fluffing the bottle first. The recommended proportion for this material is 1:1. Dispense 1 scoop of powder, making sure to level the scoop with your spatula. Place the powder on one side of the treated paper pad. Recap the bottle after dispensing. Dispense 1 drop of liquid on the other half of the pad, making sure to recap the bottle after dispensing. Gather all of the powder with your spatula and incorporate into the liquid, mixing completely and thoroughly until the material has a glossy appearance. Total mixing time should take no longer than 30 seconds. Gather the material with a black spoon to line the casting for cementation.
So personally, I would always just pick it up with the spatula and line the crown with that versus that little black spoon that was showed, but that's also potentially another way that you could do it. So that's polycarboxylate cement. let's next move to our zinc phosphate cement. So you're going to notice on this one that we have a phosphoric acid liquid. So if you're looking at boards and they're asking you like what ingredients are in these different types of cements and luting agents, the name usually gives it away. Okay, there's going to be zinc and there's going to be phosphate. Okay, they're probably in a zinc phosphate cement, probably would not be a polycarboxylic acid. Okay, so we're recognizing that those names are going to be in the name of the cement when it comes to boards. So that will make it a little bit easier for you to remember. But some of the details you're going to have to, memorize. So this particular one, the zinc phosphate cement, is one of the oldest cements, and it's used today as a permanent cement on crowns. And it's very strong, very low solubility. It has an exothermic setting reaction. Reminder, when we have an exothermic setting reaction, what should we mix something on? A glass slab. And you might see that on boards where they're like, why would I use a chilled glass slab? Something about that exothermic reaction. The ones that we use a glass slab for that have that type of reaction, zinc oxide eugenol and zinc phosphate cement. So you might want to put a little note up under your zinc oxide eugenol. I don't have it on there, but an exothermic reaction. That one's because you could do it both because it already has a long working time. But if you need a longer working time, you could do a glass slab. But this one for sure, we're going to need a chilled glass slab. Usually we would keep it in the fridge at the dental office. So this will allow more powder to be added to the mix for the desired strength. And this one will also string up 1 inch above the pad because as I mentioned, we're learning how to mix these as that luting agent. So they will usually all string up. So the brand name on this one is Flex if you've used this in potentially private practice before. The next one that we're going to talk about is our glass ionomer cement. And I've drilled into your brain this semester that the unique thing about our glass ionomer cements is that they have, you should tell Miss Harvey, what is it they have? Fluoride. So smart. So this one has a polyacrylic acid liquid, but the powder in it is a glass powder. So a little different from some of the others, but we're always mixing some type of acid with a powder. So this one in particular that has glass in the name, a glass powder that we're mixing with that. And you could see above, where else do we use polyacrylic acid liquid? We use it in our polycarboxylic cements, which are, pretty much phased out, over time, not used as often anymore, but we use them quite a bit in our glass ionomer cements. So this one in particular is our material of choice. So let's go ahead and look at how to mix our zinc phosphate cement.
This video will demonstrate the process of mixing zinc phosphate cement. Zinc phosphate cement is used, we'll see two examples of the procedure for mixing zinc phosphate cement. One is luting and the other one is for a base. So the first step is to fill the cap up to the dome line with powder. She's just tapping down to level it out. Okay. And then as soon as you get that, you pour it onto the glass slab that's been chilled. And now you'll see she's dividing the material into about 6 fairly equal portions. You can start by first dividing them into 4, and then she'll take some extra from one of the piles. So now that you have about 6 piles to go with. So the next step is to empty 6 drops. You want to turn the container completely upside down and let 6 equal sized drops fall onto the slab. And now you're ready to mix. So she will incorporate one of the increments of powder, and you need to spread the material over a wide area because of the exothermic reaction. And then you just simply add the additional increments in somewhat of a circular motion or a figure 8 type motion. And like I said before, the first consistency we're trying to achieve is a luting consistency. And that always comes first because of it's more of a stringy Whereas a base consistency is going to be more of a ball that you can roll into a ball. So she's getting close. You try to incorporate the material into one area. So let's see. You can see the material as it strings off the spatula. Okay, so now that's the first consistency we've achieved. And now she will continue to add powder to get.
So as she mentioned on this next one, now she's going to make it into a base, but most often people are using this for a eluting agent, but we could be using it as a base where she's going to roll it into a thicker mixture as well.
Get it into a more stiff base-like material. And ideally, once you get to that consistency, you will be able to actually roll it into a ball, or sometimes it's nice to roll it into a cigar shape if you're putting it into a temporary or into a restorative situation where you want to cut off pieces of the cigar shape. But it really doesn't matter. So she's definitely got that consistency. You can see she's rolling it into a ball, and we've achieved the final base consistency. And that is all that's to it. You want to, now this is a very sticky and hard to remove powder once the powder and liquid are incorporated. So we ask that you use baking soda when you're cleaning your tray, and the material will come right off. If you don't use baking soda, it's very, very difficult to remove the tenacious consistency.
I've never tried that tip before where we're using the baking soda. So let's look at some of the features of the glass ionomer. This is the material of choice for eluting metals. So eluting is cementing metals like our gold and our PFM crowns. They were using this pretty heavily. It is chemically activated as well as light activated. There's a lot of different versions of this that are out there. So it could just cure on its own, essentially is what that means, or we could take a curing light to it, depending on which type of glass ionomer we would like to use. And then glass ionomer products are the strongest and least soluble dental cement. I think that that's mostly because they put that glass in it, making it a really, really strong material. But we're going to get to one that's up and coming, that's being used a lot more than glass ionomer, that's pretty strong as well. But compared to the first three, it's the strongest. So with that, we also know that it releases fluoride. It's biocompatible and it's very adhesive to this tooth structure. If you've worked in private practice before, you know the brand name to be Fuji-Sem. It's a permanent cement, and then you can mix it on a mixing pad, or there are times where, and we'll look at this next semester, it comes in a little capsule. You put it into what's called a triturator, and it mixes all of the acid and powder together, and then you can expel that material into the area where you're wanting to place it. So let's look at how to mix a glass ionomer cement together.
So I'm going to show you how you mix glass ionomer now. It can be called P-fill, or it might say on the bottle GRC, it depends on the manufacturer's name. So you need a pad or a glass slab. I normally prefer it on a glass slab, but with the pad you can just take it off and then put that in the bin afterwards. You need a spatula. Now I'm going to spatula first of all, and you mix with the pointy end, and then the flat end is for segregating powder. So always mix your powder first of all, then tap it down on the lid, and however many drops you want. You need to pull this up slightly. That one as well, like that. Oh, will it? Yeah. Right, never do it like this because it's not a clear drop. It should be held up in the air and then you press it slightly. So 1 drop, 2 drops. You can put your lid back on. You get your powder. I normally choose the pointy end first of all. And then you should line it up. And then put it into sections because you need to do a section at a time. So the first one, you can use your pointy end to mix. So depending on the consistency, some dentists use this for cementing crowns. You'd need slightly runnier than this, but you shouldn't be getting more with that side. You use your other side. You've got 1 dry side and 1 wet side. And you're kind of just mixing it all in and pushing it down. You put some powder on the back, so I'll push that down as well on there. And on the back, keep turning it and keep gathering it. So if this needs to be slightly thicker, for example, for a child to fill in, just keep adding a bit more at a time. And scrape it all up. Then you can leave it on the edge for the dentist. Wipe your spatula straight away so that that doesn't go through to the decon room with anything on. Always put everything back into the jar with your flat end. And then I always get a tiny bit of Vaseline as well. And I'll put that on because this feels slightly gritty in the patient's mouth. The dentist sometimes will use the glass enamel and then smear the Vaseline over the side as well. So that's the correct consistency for a filling for a child.
So someday when you get to place restorations, you could do it where you're mixing it, but most of the time when we're placing it for restorations, it's in like a pre-measured capsule, just for ease to make it quick and things like that. But you saw in the beginning how she mixed it to that luting agent consistency, and that's what we would use to cement some type of crown potentially. And we cannot cement permanent crowns, depending on the state, but we can do temporary crowns, so keep that in mind. The last one that we're going to talk about here is our composite resin cement, and this is going to use um, bonding versus luting. So as you can see here, it has the word composite in it, and it's going to be more like a restoration that will bond the tooth to the crown, or usually they're using this especially on veneers. And so keep in mind that there's a composite aspect to it. So as we look at some of the descriptions here, we're going to use what's called dentinal bonding to be able to use our composite resin system. What that means is, it's different bonding something to dentin versus amalgam. And even sometimes with dentin, we've got primary dentin, we've got secondary dentin, we've got tertiary dentin. So making sure that we have the right systems that bond to those particular tooth structures and adhere is important, because sometimes we need bonding only to enamel, and that's going to be different if we need bonding to dentin. So when they say this is a dentinal bonding system, usually the dentin is going to be exposed when we're using this type of restoration material. And that means that there's going to be tubules open for our material to get down into the tubules and be able to physically adhere, as well as have that chemical adherence at the same time. So it does mention here they contain a higher percentage of the resin matrix material, and that's due to viscosity. And then it is the material of choice for luting all ceramic restorations. So our zirconiums, our emaxes, our veneers. You noticed above with our glass ionomer cements, it's great for like PFMs and metal crowns, which they're not being used a whole lot these days. So these composite resin cements have become more of the standard of care. And there's a lot of different brands out there, but maybe you've heard of like a Reliax if you've worked in private practice before. And as mentioned, these also sometimes come in pre-measured capsules, or they come in some type of auto mix gun to be able to mix these. We're not often mixing these by hand with a liquid and a powder, so they're going to be mixed a little bit differently. So let's go and look at this particular video here. So did you see on that last video when they were removing the excess material around the margins and they did it with a scalpel? When it comes to boards and they ask you what's the best way to remove an overhang or what's called flash? Sorry, I should say the best way to remove flash, not an overhang, but flash is going to be with a scalpel. So that might be an option that you see on boards. And we're going to talk a little bit more about that next semester when we get into expanded functions. Also, you notice that there was a little strip, an interproximal strip that goes in between the teeth that you can smooth out yourself if there's a little ledge on a restoration. Sometimes the dentist will have you get one of those. The dentist will floss that between the teeth and they'll smooth out that ledge if you're not able to like smooth it out with like your sickle scaler. So keep that in mind. So those are the composite resin ones, and they are really great for cosmetic purposes because if you can imagine, like our glass ionomers are clear cements. So if it's clear cement underneath and it's such a small veneer, it will shine through that color. So they're really finding that if they get the right color of composite resin cement, then they can make those look really cosmetic. Now, you noticed on this last cementing agent, these composite resins, there was nothing that we had to mix. It was almost as if we were placing a restoration, which we've looked at in our previous two courses with our, especially with our direct restorations. It looks just like a composite, but we're using it to cement something on. So kind of interesting there. So the next thing I want to do is have you look at what cementing something actually looks like. And then we're also going to talk about cementing an implant because I think it's really interesting to see how it's done. Obviously, as hygienists, we're not doing it a whole lot, but board still requires us to know the materials. And it's very important to know the procedures because we are going to be the ones that's going to be explaining these to the patients. So I just want you to see these two different ways to cement something, and then we'll move on to adhesives momentarily. Let's watch this first permanent crown cementation, and he's going to show taking off a temporary crown and what that looks like. Nowadays, there's cementing crowns same day in many offices, but you might still see like temporary crowns out there. So he'll show that, and then he's going to show cementation of a porcelain fused to metal crown.
A temporary crown that was done previously. Now, what the temporary does, covers and protects the tooth, cuts down on sensitivity that the patient may have. Also keeps the tooth in alignment. Teeth drift, and if you don't keep them in alignment, if we get the crown back from the lab and it wouldn't fit. So you notice temporary cement. This is very important that we're able to clean that all off because these crowns are made very precisely, and if they fit the tooth so well to the point that if we have anything in the way, the crown won't go into place. So we go ahead and put the crown into place. First thing we do is we check to see how the contact is in between the teeth. And then notice how that snaps well. We don't want to leave anything open there because food can get trapped in between the teeth. When we check the margins, we want to make sure everything is nice and even with the tooth. We want to make sure it's not overhanging into the gum. Also want to make sure it's not short. Now we check the bite. That's very important because otherwise the patient will just be chewing just on the crown itself. We need to have all the teeth in harmony that way. So we go ahead and check what we call articulating paper. It's kind of like typewriter ribbon. You notice it puts those little blue dots in areas where it's hitting a little heavy. So we're able to use those as a guide, and we'll go ahead and adjust wherever needed. Take whatever time it's needed to get that just right. At that point, we'll go ahead and are ready to seat, so we want to polish where we had to adjust. These are rubber wheels that we use. They're impregnated with industrial grade diamonds. And they get finer and finer grit to the point where we can actually get a virtually glazed surface at the end. So it works out super. And that's what crown looks like. So we're going to go ahead and cement that in now. We're going to hold that in with a cement. Now we're going to go ahead and take a little bit of de-oiling agent, and the reason for that is sometimes the temporary cement has a little bit of oil to that. So we're going to go ahead and clean
any remnants of that off. And we have a desensitizer now. Anytime we work on a tooth at all, we're going to have that possibility there could be some sensitivity in the tooth. We want to bend over backwards, make sure that there's no discomfort when we put this crown on. So go ahead and bathe the tooth in desensitizer. Make sure that we've done everything possible to make this nice and easy for the patient. Now we'll go ahead and dry that off, and now we're ready to cement the crown. Now, the crown's going to go into place with a material called glass ionomer, and that's going to set. It'll take a few minutes. We're going to go ahead and let the patient bite that crown into place and give that few minutes to let that set. And we'll do time elapse so you don't have to watch for 5 minutes while it's setting. It's important that we clean it. We'll try to do this real gently to make sure that the patient's comfortable, but we want to make sure that we get every little piece out of there. And we don't want any remnants sticking in the patient's gum, causing irritation. Even check in between the teeth. Very common place to have extra cement. Starting to look pretty good at this point. So just inspect, make sure there's no little specks of cement left. Now I'm going to floss to make sure all that's clean and looks great.
Okay, here's the next one on cementing and implants. So let me get this one queued up here.
Roundhouse implants a month ago. We're getting ready to cement his upper implants today. So we're just checking the implants here. I'm just tapping on them to check the stability of all the implants, and all of them are good. We've got 12 implants in there, and they're all nice and solid. We've got our zirconia porcelain roundhouse bridge, layered porcelain bridge that we're going to be cementing now. We've already tried it in, and I've done a little bit of adjustment to his lower temporary to adjust the bite. So this is all ready to go. Go ahead and dry the teeth. We're going to dry everything up. And I'm using the Champion First resin cement. I'm going to fill all the holes about 3/4 of the way. You can hold the seat there and bite together for me. Okay, open, bite, nice and tight. Just hold that together. Just bite. Just hold that for a couple minutes, okay? We'll let that harden up for about 3 minutes, and then we'll clean off the cement.
So I'm just gonna go around the gum line and make sure that there's no excess cement still stuck to the upper roundhouse. And remove it with my Explorer.
The upper brickwork is cemented now, and we've been all cleaned up. And make some minor adjustments to the occlusion. So that was cement of an upper roundhouse bridge. Thank you again for joining us.
So that cementation case was pretty interesting because they used a resin cement to cement that whole thing onto the implants, right? But nowadays, they're actually retaining those implants more and more with screw. They're having screw retained because what they found is that when the cement kind of pushes down around those implants, it creates areas for bacteria to harbor, and then you can get implant failure and peri-implantitis. So we don't see that cementation being used quite as often on implants, but in some cases, some dentists may do that. So little heads up on that information. So let's go ahead and take a little break for 10 minutes or so, and then we're going to come back and talk about adhesives. So the next thing we're going to talk about is our adhesive materials that are out there and available for us. So we're going to go over like how things stick, how we can get things to stick. Obviously, we talked about this one with composites. We mentioned that sometimes like our sealants were micro or macro mechanical bonding. Sometimes we need to create um, those little cavities in the teeth like we do with sealants to get things to stick. And sometimes it's literally a glue. So that's would be like bonding. So we're going to talk about some different terms that are important to know when it comes to boards and adhesives. So let's go ahead and take a look at this little video here to start.
AdPer Easy Bond Self-Etch Adhesive is a new one-bottle 7th generation bonding agent from 3M SV. AdPer Easy Bond Self-Etch Adhesive offers a very fast application time, along with bond strengths that are greater than or equal to other 7th generation adhesives. In this segment, we will go through the AdPer Easy Bond procedure step by step. After the cavity has been prepared, it should only be dried to the extent that there is no water visible on the surface. Over-drying may result in post-operative sensitivity. In addition, a rubber dam is the recommended form of isolation. AdPer Easy Bond can be dispensed in either a vial or unit dose dispenser. For the vial, a drop of AdPer Easy Bond is simply placed in the dispensing well. For unit dose dispensing, hold the shaft of the disposable applicator with one hand, covering the blister opening with your thumb. This will prevent the adhesive liquid from splashing out. With the thumb and index finger of the other hand, squeeze the reservoir of the unit dose blister, starting with the outer end, in the direction of the disposable applicator. Turn the disposable applicator back and forth in the liquid to wet it completely. Apply the brush to the prepared cavity surface and scrub in the adhesive for a total of 20 seconds using mild finger pressure. Next, air thin the liquid for approximately 5 seconds until the film no longer moves, indicating complete vaporization of the solvent. Light cure for 10 seconds. The surface is now ready for composite placement. AdPer Easy Bond Self-Etch Adhesive combines a very fast and easy application technique with strong bond performance and low incidence of post-operative sensitivity inherent to self-etch adhesives.
So you can see there how some of the bonding kind of works. We're going to go through that towards the end as well of this presentation. And then, gosh, this is so important for us to know because obviously pretty soon up and coming, we're going to be able to place restorations. And a big piece of that is going to be being knowledgeable about adhesion or bonding. So next, let's talk about some of the terminology that you'll need to know when it comes to adhesion and bonding. So of course, we're joining two objects together. We want to join the tooth to the composite materials. So the adhesive is actually the material that sticks to the flat surface or that bonds two flat surfaces together. And then our adherent is the surface that the material is being bonded to. That would include enamel or dentin in this case. And then we have two different types of bonding, micro-mechanical bonding and macro-mechanical bonding. And we talked about this a few weeks ago, but do you remember, obviously, micro is going to be tiny. Really small irregularities in the surface. You can't barely see them with the naked eye or, film with the Explorer even. And our macro mechanical bonding is going to feel rough. It will be able to be seen. And that is the mechanism by which we're able to glue two, of these things together that we need to glue together. So next, let's talk about retention of the restoration. So adhesion, of course, is used to keep our restorations in place. Sometimes, remember me drawing on the board those little undercuts, that creates a mechanical lock when I can't have the option to have adhesion, because as we know, with an amalgam, we do not use a glue to stick that in. We just place it into the preparation, and it makes it so that it doesn't come out as it hardens. Another important reason for something to adhere to one another is that it's going to reduce this what's called micro leakage, which is where the fluids might seep into that junction between the tooth and the restoration. And when we have micro leakage, then we might get what's called recurrent caries. And then there might also, because of that fluid movement, you might have post-op sensitivity as well. So adhesion, also another thing that it does, because it prevents that leakage of fluid, it reduces staining. So if we don't have great adhesion, then we might see some staining around a restoration from that micro leakage. So how do we sometimes get this micro leakage? Through a process called what's called percolation. Now, if a restorative material does not match that thermal expansion, we talked about that in chapter 2, clear back at the beginning of the semester. We know that teeth and dental materials, they expand and they contract when there is hot or cold in the area. So we want something that has the same thermal expansion for a restoration as we do the tooth. Otherwise, if it doesn't match that thermal expansion, we get potentially an influx of fluid as the composite material gets has shrinkage because of the cold. Then the space opens up, and then we get percolation. Then we can get micro leakage. Then we can get recurrent caries. What about reducing recurrent caries? This says here that the smooth surfaces of the teeth and sealed margins are much more resistant to decay than pits and fissures and gaps at the margins of restoration. So it makes it really important. You see all this micro leakage, possibly from percolation, staying around that tooth structure, might get recurrent caries. We want to prevent that, and that's why we're using these structures. So clear back in the 1950s, that's when they started to use acid etch to seal pits and fissures. This was a way to bond things or adhere things to the tooth. Obviously, you can see in image A, normal enamel tooth structure, and then in image B, how we can see that there's a lot of concavities in this tooth structure. So then if we were to use a sealant material to flow into those areas and it hardens in those nooks and crannies, all becoming one piece, it makes it so that it attaches to the enamel and can't pull back out because it's mechanically retained. But I did not use a glue to make this happen. So next, let's talk about the chemical adhesion, like the glues, okay? So in the 1970s, they developed our first polycarboxylate cement, which we talked about earlier, and that created a chemical adhesion. And that polycarboxylate cement and glass ionomer, they can be bonded to dentin and to enamel. So now we don't have to take away any tooth structure microscopically, or maybe we do a little bit of both, really to get quite a bit of adhesion. And with some of these, you're going to hear this word, dentinal bonding agents. Just essentially, if you can see the yellow image right here, the little cheese looking one, we want to, at times, if we can get some of the bond down into the dentinal tubules, that's going to help retain and create a kind of a mechanical retention to adhere to the restoration. So if you could imagine for a second, if we were cutting wood and there was sawdust all over the wood, right? We've talked about this a little bit before. If we adhere just those two wood pieces covered in sawdust together, it would not bond very well. So it's very important that we clean the tooth surface so that we can get an accurate bond and that it's not covered in debris. So some of the things that we have to remove before placing things on the tooth structure for adhesion are our biofilms, of course. So even though we might have even the pellicle, and then on top of that we have plaque, we wouldn't want to bond something right to that surface because we have to prepare that surface beforehand. So sometimes even certain instruments or certain materials might even need you to place a rubber dam to prevent any saliva from getting contaminated, or for sure isolate the area, because if we try to adhere something and there's saliva in the way, that might not work out. Now, there are some products, as I mentioned to you, gloss ionomer, where we actually utilize the water or the moisture that's on the tooth, and maybe some of those biofilms, we don't clean it that well, where we can place those on the teeth and it will still adhere because of how it chemically works. So that's kind of cool. So let's first talk about bonding and adherence in enamel. So what we do here is, you can see this like kind of pinkish area. You can see that they're doing an acid etch. They're going to use that to bond materials to enamel and not dentin. We don't usually use an etchant when we're bonding to dentin because we have the dentinal tubules already to work with. So an enamel bonding material is more effective to bond and ends of the enamel rods to the long axis of the tooth. So it just adheres to those enamel rods essentially. So this acid etching technique has a built-in quality check. So if the enamel is properly etched, it is going to appear what color? Kind of a chalky white, right? So then you know, okay, my surface is prepped and ready to go. I have essentially taken the minerals out of the tooth structure. Our Pitt and Fisher sealants prevent caries, and margins of restoration stain less frequently when we use our acid etch technique. Let's talk about what that acid etch even is. It is phosphoric acid, 37% is what we most commonly use. That's what we have here in our clinic. The etch is going to remove that enamel rod portion, leaving a rough surface, and then it is possible to etch over. And then crystals can potentially form from calcium and phosphates that are initially dissolved, and that is going to help with our bonding. So you're going to see on boards, it could be called etchant, or it might be called conditioner. Rather, and the book says don't call it an acid, but and sometimes like with little kids, they'll be like, I'm going to use this soap on your teeth because it tastes like soap. It doesn't taste very good, right? I remember doing that on sealant day. But on boards, they might say, what conditioner percentage is it that you would use for a sealant? And you're going to say phosphoric acid, 37% is the conditioner that I'm going to use. So let's talk about acid etching. Do you see these little chalky white areas here? This has created those microscopic enamel tags or little micropores. And you know how we do that? It's just like with a sealant. They clean the surface, rinse the area dry, etch for 15 to 30 seconds, rinse dry, bond, and then you layer the restorative material. And then usually, why is it 10 to 30 seconds? Sometimes even deciduous teeth could be a little bit longer, mostly because deciduous teeth, their enamel rods are a little bit less fully arranged, and so it takes a little bit more time to break those down. So sometimes they do say on deciduous teeth, you might want to go with that full 30 seconds versus the 15 if you are etching something. Also, just like with our sealant materials, if it does become contaminated with saliva, you can re-etch it, but you would only need to do so for 5 seconds. That's because a full remineralization is not going to occur, but still some did occur. Some of those minerals did fill back into the teeth once the saliva touched it, but we don't have to do it quite as long. Of course, when we're etching, we want the surface to stay clean and dry, and the surface is very sensitive to contamination after etching, so you have to be really careful. When we use like a sealant material, we want good wetting, and we've talked about this concept before, not a good, wetting, but a good wetting. You can see here in this image, we don't want something to just stay on the top of the tooth and not fill into those surfaces. So that's why they make sealant materials, so that they flow right into those nooks and crannies, and they have good wetting, good viscosity, so that we can get a bond in there as well. We want our bonding and adhesive systems to flow into those areas because that's what our composites are going to adhere to. And our composite material is going to bond chemically to this bond material. So once again, just a reminder, our dentin, there's a lot of different types: intertubular, peritubular, secondary, primary. And so it has been tricky to find a good dental material that will really adhere to all of those surfaces depending on how deep the restoration actually is. So that's why they've done a lot of work on building products that have atomic bonding, micromechanical bonding, and that will help prevent micro leakage and recurrent caries. Very important to be following the manufacturer's directions on these so that we don't get that percolation, micro leakage, and recurrent caries. Here's a reminder what a dental tubule looks like. Do you remember this little fiber in the middle? Do you remember what that one's called? This says it's called a collagen fiber, but that is our odontoblastic process. And that can allow us to regrow dentin and fill in those dentinal tubules, making tertiary dentin if needed. But that sawdust, when the dentist drills, that kind of goes all over the teeth in a microscopic layer, is called the smear layer. And actually, when you instrument on a root surface with hand instruments, you create a smear layer. And if that gunk is also sitting on the root surface, you don't get as great of healing. So there are products out there that do help remove the smear layer when you're instrumenting, like a weak acid. I particularly like the Hybenex Perio DT product that I've been using in private practice. So that's kind of cool. You'll get to use that someday when you graduate. But when the dentist drills, there's shards of tooth and dentin and enamel that go everywhere, and it lands on these areas that we need clear because we need to be able to put a bond down so that we can adhere this to the tooth structure well. So usually they'll remove this smear layer with some type of acid and it will dissolve. They have gotten smart and said, hey, you know what? There is a smear layer here. It has tooth structure in it. Why don't we gather up that tooth structure with a product as we put it down in there and we utilize that smear layer. It kind of picks it up, turns it into like a sludge, mixes with the bond, and becomes a really great bond with us because we're using the smear layer to our advantage. So kind of interesting that we've seen some products come out that incorporate the smear layer instead of just dissolving that smear layer altogether. Now, there's so many different types of dental bonding systems out there. And when I was an assistant, there's one that had like 4 steps, and then there was one that had 2 steps, and then there's one that had 1 step. So it really has, over time, we've seen a lot of innovation with bonding systems to get them to stick, things to stick to the teeth. And it's shorter steps that does the same properties. And so more and more we are using just really quick bonds that work fast. What is a primer? Maybe you've heard of like a prime and bond before. So primers are used when we have to bond something to the enamel surface as well. They have a really low viscosity and they're more hydrophilic, but these will also contain a solvent like an alcohol that will make it really thin and it will flow over the area. And it has it's a really great wetting agent that can get into open tubules and around collagen fibers. And so you might see like a prime and bond. And nowadays, like the one that I used to work with forever was a prime and bond, as they just called it, prime and bond. But nowadays they have one that is a mixture all in one. So it just makes it so much quicker. So what about adhering glass ionomers? Now, the interesting thing about a glass ionomer restoration or cement is that you do not need a bond to have it adhere. The actual material itself is the filling as well as the adhesive material. So for example, if I put a composite in a tooth, I have to use a bond to make it stick. But if I put a glass ionomer in, I literally just take that glass ionomer that I just mixed up, I can put it directly on the tooth and it will chemically adhere to the tooth surface. Now, there are some people out there who do say that it is still great to condition or a type of etch the tooth prior to glass ionomers. Some do, some don't. It depends on the material. But usually they'll say use a polyacrylic acid before placement of a glass ionomer. Different from phosphoric acid, but looks kind of the same. Usually it comes kind of a greenish color. But if you have a conditioner that you use before glass ionomer, they'll adhere even more. And then that very last line says the smear layer is removed and there's better bonding and it doesn't decalcify. With glass ionomers, that's why the reason you'd want to use that polycarboxylic acid is to remove that smear layer. Even on glass ionomers, even though they're adhering chemically, it's great to have that surface prepped for you. So when do we bond in dentistry? You can see here that essentially when you do a sealant, you're bonding that through mechanical retention. When they place ortho brackets, how do those stay on? They're bonding it through adhesion, enamel to the metal. Isn't that crazy that they can bond composite to the metals, to the bonds, and really, make straight teeth that way. We also maybe want to, use different bonds for root surfaces, and we would want to do some dentin bonding for composite fillings too. And then here's an example of our glass ionomers. You can see here all this carries, and then they filled that in with a glass ionomer restoration, and they didn't even have to use a bond. They probably used some type of acid to prep the tooth surface like we're supposed to, but you can place this directly in, and how much better do those look afterwards, right? I'm so grateful for restorative materials that they're available to us to be able to use for our patients. We've been so focused though on building amazing restorative materials. I feel like sometimes we forget about the opportunity to prevent and what we can do more as dental hygienists to prevent caries earlier and sooner with like silver fluorides and curodonts that we're going to learn a little bit more about next semester. So this next step, I'm actually going to have Miss Harvey, she's going to pass out a little sheet of paper to everyone. You can work together individually or as a group, however you want to work it. And I'm just going to have you match the vocabulary with the topic that we've gone through, like percolation, what is micro leakage, and things like that. And we'll probably give you, 5 to 10 minutes to do that. And then we'll show you the key and you can correct your own work and then get that uploaded to Google Classroom. So that's what we'll do for the rest of the time. We'll work on that and get that uploaded to Google Classroom. And then I will also make your quiz come live within the last few minutes of class. So if there's extra time, you'll be able to work on that. And then we'll just dismiss right on time. So we will go to that point. If you have any questions throughout this, feel free to email me personally, and I'd love to answer any questions for you on any adhesives and cements. So we'll see you in lab. We'll see you in lab soon.